This chart tracks the initial claim denial rate across the U.S. healthcare system. Over a few years, it's steadily climbed, peaking at 11.8%. Adding up every rejected and abandoned claim, the industry lost an estimated $262 billion in a single year. But if you operate a medical practice in New Jersey, that national average does not capture the full reality on the ground. You are operating inside one of the most complex, tightly squeezed payer environments in the entire country. Take a look at how local reimbursement rates stack up against national Medicare benchmarks. New Jersey Medicaid pays primary care roughly 50% of Medicare. Commercial insurers nationally reimburse around 120%, but in New Jersey, they average just 93%. With margins this thin, every administrative failure and denied claim functions as a compounding revenue leak, draining the practice's cash flow month after month. Medical billing requires consistency, but the workforce data shows a structural pattern of instability. Turnover for business operations staff, which includes billing and coding, sits at 33.3%. This makes the administrative backbone of a practice highly fragile. This cascading chart breaks down the true financial damage of that turnover. Between recruitment advertising, time spent interviewing, onboarding, and the productivity gap during the ramp-up period, replacing a single billing position results in a $9,000 to $12,000 penalty, and that amount doesn't capture the operational chaos. While struggling to find qualified candidates amid rising salaries, claims simply sit unworked. Every denied claim that enters the queue costs between $25 and $118 in labor alone to rework, creating a massive backlog spiral. High turnover rates, expensive replacement cycles, and complex state payer rules make running a traditional in-house billing team in New Jersey mathematically unsustainable. To solve this, a growing number of practices are removing the staffing variable. They are moving their billing operations to Staffingly, a dedicated, healthcare-specific outsourced team. This diagram illustrates how the embedded model works. Staffingly assigns AAPC and AHIMA-credentialed specialists who work natively inside your existing EMR, whether you use Epic, Athena, eClinicalWorks, or dozens of others. This is a departure from standard outsourced vendors. Because the team works directly within your system, there is no screen share lag and no cumbersome exporting of data. They learn your practice's exact workflow, your specific payer mix, and your internal quality thresholds. Healthcare data requires strict protection, so the technical infrastructure is built around compliance. Operations run under SOC 2 Type 2, HITRUST, and complete HIPAA compliance from day one, utilizing encrypted VPN access as the standard baseline. Integrating credentialed specialists directly into the workflow replaces the friction of denial management with a secure utility that protects the practice's bottom line. The operational upgrade starts before the patient even arrives. The Staffingly team runs real-time eligibility verification to clear coverage up front. From there, specialized coders who already know the specific rules of New Jersey's managed care organizations handle the documentation. Before submission, claims pass through an automated scrubbing funnel, catching coding errors and timely filing mistakes. This workflow is reinforced by an AI-augmented layer. Smart routing and predictive workload management assist human specialists, keeping the error rate strictly below 1%. And when claims are underpaid, there is a dedicated team to pursue them. Studies show the average practice abandons 7 to 15% of underpayments without appeal. Staffingly ensures aggressive accounts receivable follow-up so that money is actually collected. Combining credentialed human expertise with AI-augmented scrubbing moves your billing from a reactive scramble into a proactive revenue-capturing engine. At its core, deciding how to manage your revenue cycle is a mathematical equation that practice owners must solve to survive the local market. An in-house New Jersey billing position costs $55,000 to $75,000 in base salary. That's a $65,000 burden before benefits, taxes, and turnover. Staffingly provides a credentialed seat for $399 per week, totaling $20,748 annually. This creates a massive financial delta. Beyond the direct salary savings, moving to an embedded model eliminates the recurring $9,000 to $12,000 penalty you pay every time an in-house employee leaves. Adopting this model gives New Jersey practices the specific financial leverage needed to instantly reclaim their lost profit margins. Transitioning to this system is designed for speed. The go-live process takes 14 days to map your workflows, establish secure EMR access, and begin working your claims natively. The engagement is month to month after the initial pilot. You have the flexibility to scale the team up or down with just 30 days' notice. Stop losing revenue to a billing system you do not have the bandwidth to manage.